Hey everyone, this is Hannah with Rocket Miner. I have a news update for you today that's mostly about COVID-19, but we have some important updates on where we're at with that here in Sweetwater County as well as throughout Wyoming. So I wanted to go over those with you today. In Sweetwater County today, our active cases are down to 65. That is a lot better than it has been lately. Most of the time it's been up over 100. The last few times I checked it was close to 110. So being down to 65 active cases is definitely headed in the right direction. Unfortunately, our official death toll has gone up and has been confirmed to be at 30 people who have died in Sweetwater County with deaths related to COVID-19. There have unofficially been a few more deaths than that, but 30 is the number we're at with those that have been officially confirmed with all the proper death certification information and confirmed also by the Wyoming Department of Health. So that's where that number is at. Currently, there is only one patient who is hospitalized with COVID-19 at Memorial Hospital. So that's also been doing better, seeing less people at the hospital with it. Yesterday, there was the COVID-19 update Zoom meeting for the county with local health officials and local leaders. So they went over information about where we're at, shared the fact that our county is doing better, our numbers are improving, they're starting to level out more and kind of trend downwards. So that's good that we're headed in the right direction with that. We're currently at a 7.6% positivity rating. That is a lot better than where we were. We were up at 18% for a while, so it's definitely gone down and getting closer to where we need to be, not quite to ideal. Dr. Jean Station, the county health officer, explained that the ideal for a positivity rating is to be below 5%. So we're a little above that with the 7.6, but definitely better than we were and again heading the right direction. Dr. Station also explained that we have had close to 3,400 confirmed cases of the virus and close to 3,200 vaccinations in Sweetwater County. So with the cases and the people who are getting the vaccine, that's putting our county at around 15% immunity right now. And that could also be higher because of people who have had the virus that maybe it wasn't confirmed, but they still have that immunity because of that. So we're looking at least 15% immunity in Sweetwater County right now. One of the main things that they talked about through the COVID-19 update meeting yesterday was where we're at with vaccines and the fact that we are doing really well at getting vaccines out, but we are limited by how many doses of the vaccine we receive. So they explained that the vaccine clinics have been going really well throughout our county, and the vaccines that we get in have been being distributed really quickly, and we're doing really well even compared to other Wyoming counties. We're one of the top as far as giving out the vaccines that we receive. Most of the vaccines going out right now are from Public Health and Castle Rock, and they'll be the main ones doing vaccination clinics in the future. But Memorial Hospital has also done some and helped with that, and will be able to help in the future if they need to. So between those three, Dr. Station estimated that we have the ability in Sweetwater County to do roughly 2,500 vaccines a week. The problem is that in Sweetwater County, we only receive about 2,100 to 2,200 a month as far as the actual vaccine shipments and supplies and doses that we're getting. So we could be doing more, could be getting it out quicker as far as what we have the ability to do, but we are limited by how much we receive. So they expressed their frustration over that. Dr. Station said that obviously this is frustrating. We want to get out as much as we can, but just being limited by the resources is difficult, knowing that we could do more. But she also said she's very proud of where our county's at as far as the efficiency of getting the vaccine out and having these resources to be able to. So she's still hoping that in the future, and the more we get the vaccine out quickly, the more they'll see that they can send us more. So she's hoping we'll receive more, be able to do even bigger clinics to get that out in the future. But for now, they're working with what they have. We're still in the 1B category of people who are eligible for the vaccine. They also said they're expecting that category to expand to get new orders from the state on who's included in the 1B category. They said that'll probably include people who are aged 65 to 69 are not included right now, but they think it'll expand to include them as well. Right now it's 70 and up. And just some other groups that may become part of the 1B category. So with that, they'll have to then get the vaccine that we receive to those groups. So they said we'll probably be in that 1B phase for a while going into the future, but we are giving out the vaccines that we receive really quickly. People are getting it, appointments are filling up, so we've been doing well, and as they said, our numbers are also headed in a much better direction now. With the vaccines and with appointments filling up, there has been some confusion with some of that on who has appointments and what's full and what isn't. So the hospital sent out a press release today to clarify. They've been getting questions from people who already received their first dose and are now wondering about their second dose. So the way it's been handled so far is that when people get their first dose of the vaccine, they go ahead and make a scheduled appointment to get their second dose. Those second dose appointments are still valid, those vaccines are still available, so for anyone who has already had their first dose and was scheduled for the second, that stands, those are available, and they're telling people to keep the appointments that were made. The only thing that they're saying with appointments being full is that there are no new appointments to be scheduled for the first dose of the vaccine for January. And then as we get February's numbers, obviously appointments will open up again and people who are eligible will be able to make more appointments. But for now, they just clarified they can't make new appointments for January for the people who haven't gotten it yet, but for the people who have their first dose and need their second, keep those appointments because you're still able to go and get your second dose of the vaccine. As far as the rest of Wyoming and how our state as a whole is doing, there's both good news and bad news today. The bad news is that our death count has increased again. Today the Wyoming Department of Health reported another 25 deaths that were confirmed for Wyoming. So that brings our state just below 600 deaths from the virus. We've now officially had 596 deaths that were related to COVID-19. The good news, however, is that our case numbers are going down some again. Our active case numbers fell for the second time this week. They dropped both yesterday and today. They went down by 273 yesterday and by 195 today. So that's pretty good, significant drops in active cases. So that leaves us with 1,288 active cases today. I think it would be awesome if we could see that number go below 1,000 this week. That would be doing way better than we've been doing for several months. So hopefully that will keep going down. Also exciting, yesterday, Niobrara County became our state's first county since October 15th to be completely free of active cases. So they had no active cases reported. That was the first time that's happened for any Wyoming county since October. So that was great to hear that there was a county without any active cases. And again, hopefully just those numbers will keep trending downwards throughout the state. With all of that, it is encouraging to see the case numbers going down. It's encouraging to see vaccines going out. But our local health officials also stressed in the meeting yesterday that we need to keep being vigilant and just encourage everyone to keep being careful and taking precautions. Obviously, there are still active cases out there for pretty much the whole state, and it is still a threat, it is still a danger. People are still dying and being hospitalized, and if we get too relaxed about it, then things will just start going right back up to where they were before. So to keep it trending down the way it has been, we really need to keep taking precautions, washing hands, wearing masks, distancing, just being as careful as possible to protect ourselves and the people around us. So I just want to encourage everyone today to keep being safe, keep being smart, and taking this seriously. But it is encouraging to see that things are heading more in the right direction now. So those are the updates I wanted to share with you today. Thank you so much for listening. Keep checking with us for more news, and I hope everyone has a good night.